Video title: Association of Vitamin B12, Vitamin D, and Thyroid-Stimulating Hormone with Fatigue and Neurologic Symptoms in Patients with Fibromyalgia. Welcome to our video on the association between Vitamin B12, Vitamin D, and Thyroid-Stimulating Hormone, THS, with fatigue and neurologic symptoms in patients with fibromyalgia. In this informative presentation, we will explore the latest research findings and shed light on the potential connection between these essential nutrients and the symptoms experienced by individuals with fibromyalgia. Stay tuned to discover how maintaining optimal levels of vitamin B12, vitamin D, and THS could offer relief and improve the quality of life for patients suffering from fibromyalgia. Hello everyone, and welcome to today's presentation on the association of vitamin B12, vitamin D, and thyroid-stimulating hormone with fatigue and neurologic symptoms in patients with fibromyalgia. Let's dive right into the fascinating research behind this topic. Fibromyalgia is a chronic disorder characterized by widespread musculoskeletal pain, fatigue, sleep disturbances, and cognitive difficulties. Over the years, researchers have been investigating various factors that might contribute to the symptoms experienced by individuals with fibromyalgia. Recent studies have suggested a potential link between vitamin deficiencies and fibromyalgia symptoms, particularly in relation to vitamin B12, vitamin D, and thyroid-stimulating hormone. Let's explore the association between vitamin B12, vitamin D, and thyroid-stimulating hormone with fatigue and neurologic symptoms in patients with fibromyalgia. The reported fatigue and neurologic symptoms assessed in the study by the chart reviews to assess their correlation with B12 levels. The study was a retrospective chart analysis of patients with fibromyalgia who had documented levels of B12 and vitamin D. What are the neurologic symptoms seen in patients? The chart reviews assessed reported neurologic symptoms, including brain fog, memory loss, cognitive impairment, paresthesias, numbness, and tingling. According to the study, a total of 2,142 patients with fibromyalgia with documented levels of B12 and vitamin D were included. Of them, 42.4% had B12 deficiency, less than 400 nanograms/L. Fatigue and memory loss were more common in the B12 deficiency group. After adjusting for vitamin D levels, B12 deficiency remains statistically significantly associated with the presence of fatigue. Vitamin B12 and fibromyalgia. Vitamin B12 plays a vital role in the formation of red blood cells, DNA synthesis, and optimal nervous system function. Deficiency of vitamin B12 has been linked with fatigue, weakness, and neurologic symptoms which are commonly experienced by individuals with fibromyalgia. Does low VitB12 causes fatigue, tingling, numbness, and neuropathy? Yes, low vitamin B12 levels have been associated with fatigue, tingling, numbness, and neuropathy. The study found that B12 deficiency was statistically significantly associated with the presence of fatigue in patients with fibromyalgia. Additionally, the chart reviews assessed reported neurologic symptoms, including paresthesias, numbness, and tingling, to assess their correlation with B12 levels in patients with fibromyalgia. Does low level of VitB12 causes brain fog, memory loss, cognitive impairment, and confusion? The study found that B12 deficiency was associated with the presence of fatigue and memory loss in patients with fibromyalgia. The study also assessed other neurologic symptoms, including brain fog, cognitive impairment, and paresthesias, numbness, and tingling, but did not find a statistically significant association between these symptoms and B12 deficiency. Does low VitD causes fatigue, tingling, numbness, and neuropathy? The study reviewed concurrent vitamin D and thyroid-stimulating hormone levels to assess their association with fibromyalgia. However, the study did not find a statistically significant association between vitamin D levels and the presence of fatigue or neurologic symptoms in patients with fibromyalgia. The study reviewed concurrent vitamin D and thyroid-stimulating hormone levels to assess their association with fibromyalgia. The study did not find a statistically significant association between vitamin D or thyroid-stimulating hormone levels and the presence of fatigue or neurologic symptoms in patients with fibromyalgia. Thank you for joining me today and learning about the association between vitamin B12, vitamin D, and thyroid-stimulating hormone with fatigue and neurologic symptoms in patients with fibromyalgia. If you found this video informative, be sure to like and subscribe to our channel for more health-related content. Stay informed, stay healthy.